Good morning. I want to welcome you to our press briefing with updates on COVID-19. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we'll hear updates from our community leaders, and first we'll hear from Dougherty County Commission Chair Christopher Cohelas. Mr. Chairman.
Thank you, Chief. Morning, everyone. I want to talk this morning about a few things and be very, very direct. This past week at Phoebe, here in Albany, we lost 26 people. That is a staggering amount of people to lose in a week. It's 26 too many. And we are experiencing deaths at a rate that appear to be approaching, if not surpassing, where we were a year ago. The virus that we are experiencing here in this community is far worse than what we experienced a year ago. It appears to be worse in terms of symptoms. It appears to be worse in terms of its contagiousness. It is spreading very quickly, and we have tools to combat it. We've had these tools for some time, and now we have an additional tool. Obviously, we have vaccinations, which I understand some people still have hesitancy. And all I can do is continue to report the facts, which is the vast majority of people that are in our hospital right now, that are on a ventilator, struggling to breathe, that have to have a machine breathe for them, are not vaccinated. Majority of the people that are dying that Coroner Fowler goes and picks up are not vaccinated. The majority of the families that are having to bury loved ones, those loved ones that they're burying are not vaccinated. Those are the facts. And I'm not going to sugarcoat that. But I do want to also talk about a very important additional tool that we have here in this community that is doing a lot of good work to help support those folks that do come down with the virus. And I want to talk about monoclonal antibody treatment. It is something that works very well if once you get the virus, once you have been tested and you get the virus. And I want to make this very, very, very clear. If you feel sick and you know you've been exposed, please go get tested quickly. Don't let the virus get ahead of you, because what we're seeing with a lot of people here in the community, they think that, oh, you know, I can tough it out, or I'm going to get better. And what they do is they experience ups and downs with the virus, and before they realize it, they're at a point where they're now going to the hospital. Their immune systems are depressed, and they think because they had a good day followed by a bad day, or then another good day, that, oh, everything's going to be fine. And they either don't go get tested, they don't address the problem, or they don't get the treatment that they need. The monoclonal antibody infusion or treatment is something that we have, that Phoebe is administering. If you test positive for COVID-19, call 229-312-MyMD, 229-312-MyMD, and talk to the folks at Phoebe. See if you qualify for the monoclonal antibody infusion. It is literally a 30-minute to an hour-long process. It is most effective early on. So the faster you determine that you have COVID-19 and that you call that number and you get yourself that treatment, these antibodies have been shown to reduce the overall amount of the viral load within one's body. It literally helps the body fight the virus during that critical time period when the virus is fighting to overtake the body and shut down and harm the immune system, and causing all of those problems that we see with those people that are literally right now, a couple blocks from here, on a ventilator with a machine breathing for them. That is of critical importance. Please do not ignore your symptoms. Do not ignore the tools that we have available here in this community. A tremendous amount of hard work has gone into making sure that we have those tools, that we have accurate information, that we have the resources to get people the help that they need. Now, there are folks that are vaccinated that have gotten the virus. That's going to happen. But we continue to see those folks who are vaccinated, day in, day out, have better health outcomes and less funerals. Thank you.
Thank you, Mr. Chairman, for your comments today. We will now hear an update from our partners at Phoebe Putney Memorial Hospital. Very fortunate today to have with us the CEO of Phoebe Physicians, Dr. Suresh Lakhanpal. Stand by just one moment. Here, get you. Dr. Lakhanpal.
Appreciate this opportunity to speak to the community and to everyone here. I'm going to echo the chairman's comments and give you some information, some data to support what we're talking about. This has been a relentless, unremitting virus, and the impact on our community is great. We have had, over the past week, relatively stable number of COVID-19 inpatients. We right now see we have 172 inpatients in all our hospitals. That includes 138 here in Albany. We have 49 souls that are in our ICU. 41 of those are on ventilators. 41 people and families have been affected in a way that you can only imagine. It is a pandemic of the unvaccinated, as the chairman stated. 87% of our inpatients are unvaccinated folks. And the past week has been tragic for many families. We've lost 33 lives throughout the health system. 33 lives to this virus. August was the worst month for the entire pandemic in terms of our overall admissions. We have 533 COVID patients that were admitted, 57 COVID deaths in the month of August. You know, we talk about some of the statistics, the demographics of who is now getting infected. It's a much younger group. It's a group that, instead of it being those over 65, we're seeing our average age in the 50s. It is also one that does not discriminate, does not matter, white, black, male, or female. It affects everybody, and that's something that we all need to think about. You know, as the chairman stated, we do have a way to at least minimize some of the effects of this virus. Monoclonal antibodies have been a great success. Phoebe has administered to over 1,500 people on monoclonal antibodies, with 98% of those folks not having to be hospitalized. We've opened temporary COVID-19 ambulatory clinics, or we will actually next week open those, just across from our emergency room in Albany. We know that if you have tested positive and you are within 10 days of the onset of symptoms, there's a likelihood that you could receive these antibodies. So once again, call 229-312-MY-MD, 229-312-MY-MD.
What exactly was MyMD on the number? MyMD.
That's
the number.
I'll get that to you.
Okay.
All right, thank you. For those of you who are concerned about what's this mean to me financially, how can this impact me? You will not be charged for this. We may file insurance, but you personally will not be charged. You know, we also know, as stated, vaccination is your best protection. Vaccination will minimize the risk of infection. It will minimize the risk of symptomatology. So I urge, I encourage, I plead for you to get vaccinated. And if not for yourself, for your loved ones. I want to take a moment and just thank Governor Kemp for giving the day off today for state workers to allow them to get vaccinated. Phoebe has set up 2 of our mobile wellness health centers at the Civic Center, and we are ready to give vaccines out. We'll be there till 2 o'clock. Please, you do not have to have an appointment. Anyone over 12, please drop by, and we are happy to vaccinate you. This is a long weekend. It should be a weekend that we can enjoy, but I'm going to ask you to be safe. I'm going to ask you to get yourself vaccinated, wear a mask, socially distance. Don't put anyone you love in danger. Don't put yourself in danger. There is fake news. There is conjecture. And I'm going to say there's Facebook, and I suspect I'm on it. And you can read about things without understanding, has there been scientific proof or basis? Some people have talked about ivermectin as a treatment. That is a drug that is used for treating parasites in animals, and for whatever reason, it has become the hot topic as a potential cure for or treatment for COVID. It is not. The FDA says it's not. The CDC says it's not. We will follow the science, as we always follow the science, and I ask you to do the same. You know, lastly, I would like to thank our community for all the well wishes, all the prayers for our 4,500 employees throughout our health system. We fight every day for this community. What I would ask you to do, though, thoughts and prayers are helpful. Getting vaccinated is probably the best thing you can do. Thank you.
Thank you, Dr. Lackenpaul, for being with us today, providing an update. And Dr. Lackenpaul, we will invite you back to be with us again real soon, whenever you'd like to come back and provide update to our community. And we will get that number. Dr. Lackenpaul is still here, and we'll get that those actual numbers for my MD. Okay, very good. Thank you so much. Thank you. We will now hear an update from the Department of Public Health. Dr. Charles Ruiz is here. He is the director of the Southwest Georgia Health District.
Good morning. I have a fairly brief message today, but one that I hope everyone will lend an ear to. The spread of COVID in the state of Georgia continues to go up, and that includes Dougherty County. If we look back over the last 14 days, there have been quite a lot of new cases. Per 100,000 people, that number comes to 1,332. That's a very high rate of spread. Actually, all 159 counties in Georgia are in the rate of high spread. I want to also mention the COVID virus. Most of them survive, but not all of them. For the month of August, there have been 4 documented COVID deaths among children in the state of Georgia. 1 is far too many, but our adults are at risk and our children are at risk. We really need to take this seriously. I'm glad to say that each and every day we have more and more people vaccinated. getting a vaccine is the number one thing that we can do to protect ourselves and to improve the health of our community. Throughout the state of Georgia, most people have already decided that getting a COVID vaccine is a smart thing to do. Currently, 51% of Georgians have had at least one COVID vaccine administration. 45% of Dougherty County residents have decided that the COVID vaccine is a good thing to do, and they've had at least one vaccination. 38% of those who live in Dougherty County are fully vaccinated. The number is not as high as what we would like to see, but we're very grateful that every day people are considering the facts. They're starting to ignore some of the fake news that was mentioned earlier. And when they consider the facts, they come to a conclusion that the vaccine provides far more benefits than those rare occasions when someone might have a significant side effect from the vaccine. I would like to share a slide with you today. We have data from, actually from the Joint Commission. They have taken a look at the number of deaths that have occurred since the beginning of the pandemic, January of 2020. Throughout the United States, we've had over 500,000 deaths. And they're illustrating here the proportion of vaccinated deaths compared to those that are unvaccinated. It may be a little hard to see, but what we're looking at here is basically 10 football stadiums, and every blue dot represents the death of someone who is not vaccinated for COVID. And up in the right-hand corner, that one football stadium, you can see near one of the end zones there, there's some orange dots. You almost have to have a magnifying glass to see them. But those are the folks who unfortunately were vaccinated and yet died. And you just glance at that and you can see the odds of dying from COVID after you've been vaccinated pale in comparison to your chance of dying without the vaccine. This next slide shows data from the week of August the 25th through August the 21st of this year. Again, we're looking at the blue dots that represent those who were not vaccinated, and the orange dots are those who have been vaccinated. So there were 5,564 COVID deaths during that week. And you can see that those who were vaccinated, some did die. Those are represented by the orange dots. And that's a very, very small fraction of the total deaths. The vast majority are those who were unvaccinated. So again, we're not saying that the vaccine is perfect. We don't have any vaccines that are perfect. What we're saying is that if you're vaccinated, you have a much better chance of avoiding this virus. You have a much better chance of not dying from the virus. By not getting vaccinated, you're hurting yourself. You're also hurting your community. Vaccines are readily available throughout the community. We don't really care if you get your vaccine at the hospital or a drugstore or a doctor's office or a clinic or at the health department. The main thing is just get the vaccine if you are eligible. We want to remind you that eligibility starts at age 12. And in public health, we still have all 3 vaccines to offer. The Pfizer, which is available down to age 12. We have the Moderna and the Johnson & Johnson. We do want the community to know that even on Labor Day, vaccines are readily available. Public Health has partnered with Phoebe Putney Memorial Hospital and CORE, and vaccines will be provided at the Phoebe North Campus on Palmyra Road Labor Day morning, this coming Monday, between the hours of 9 and 11:30. There's no appointment required. There's no charge. We have a blinking sign out there near Palmyra Road to show where the event will take place. If you haven't been vaccinated by then, please consider coming by and letting us help you to do that. So I want to leave you with some thoughts about what you can do to help us fight this virus. If you haven't been vaccinated, please consider getting that vaccine right away. Go a step further. Help others to get the vaccine. Maybe there are people who you know who don't understand the facts. You can help share them. There are people you know who may have transportation issues. You might can help with that. Or you may just know people who need some encouragement. Maybe you have a powerful testimony. Maybe you have been vaccinated and you know someone who was afraid of the vaccine. Maybe you have lost a loved one, someone who did not get vaccinated. If you have a powerful testimony like that, please don't keep it to yourself, because the bad news seems to travel like wildfire. Good news doesn't seem to travel as readily. So if you have an opportunity to give a testimony, to encourage other people, please do so. If you're symptomatic, if you have symptoms that are consistent with COVID, please stay home. Seek the advice of your healthcare provider. Consider getting a test. But please don't spread germs around the community. That could cause other people to get sick or to lose their life. Please remember that practicing social distancing can help reduce the spread of the virus. Wearing masks can also help greatly. Hygiene is another thing that we can do to reduce the spread. I want to urge you, consider what you have done for your family. What have you done for your community? In the world of healthcare, the first thing we learn is do no harm. And I want to extend that thought to everyone in the community. Don't do any harm to your community. Be a part of the solution. Be a helper. Be a healer. And by all means, if you're not vaccinated, please do so as soon as possible. Thank you.
Thank you, Dr. Ruiz, for your update and your comments today. We will now get an update from Dougherty County Emergency Medical Services. And today we have Training and Compliance Supervisor Dickie Livingston to provide an update.
Good morning, everyone. E.M.S. has seen a marked increase in confirmed positive cases as well as suspected COVID cases in the last 3 weeks. This first slide shows an increased positive cases that we have transported, and the data is from the start of the pandemic until the end of August. So you can see at the end on the right-hand side of the slide it is going up again, and this is our 4th wave of COVID infections since the pandemic started. The next slide shows the month of August, and you can see at the end of the month we have increased again. Transports are still climbing. We are currently treating or transporting 10 to 12 patients that are confirmed positive a day. Recently learned that if a person already has a positive test from a healthcare facility, that the Department of Public Health, which is where we get this data from, doesn't always include them in our transport data. We actually get this information from the patient themselves. Last week, August 23rd to 29th, 14.2% of our patient transports were confirmed positive. If you add in the suspected cases, which are the ones that show signs and symptoms of the flu, of the virus, this jumps up to 20.8% of our transports. Since this past Monday through this morning, 13.9% of our transports were confirmed positive, and a total of 32.3% of our patients were either confirmed positive or we suspected them of having the COVID. The next slide shows how this variant is easier to spread. It is more contagious than the first go-rounds, the first ones. Whereas you're unprotected, you go out and you get in a group, talk with them, you can infect 5 or 6 people at a time, okay? It is very, very important to practice social distancing and wear a mask of some sort, okay? The next slide is from the CDC and shows the numbers you can call. Phoebe has set up their number. It is 229-312-6963. You can schedule a time to get a vaccination. And Phoebe also has 2 mobile medical units that are traveling around different sites here in town and also out of town. These trucks have everything that is needed for the registration and vaccination for the ease of access to that actual vaccine. These trucks run Tuesday through Sunday and are staffed by nurses, okay? The next slide shows that if we can get everybody vaccinated, the virus will slow down. It's been proven fact. They talked about it earlier. Up north, there are states up north that are not having any problems like we are down here because the majority of their people are vaccinated. So please, please consider getting vaccinated. Remember, we've got a holiday coming up this weekend. Please social distance and wear a mask and wash your hands. Thank you.
Thank you, Ms. Livingston, for your update today from Dougherty County Emergency Medical Services. Our final presenter today is the Dougherty County Coroner, Mr. Michael Fowler.
Good morning. I personally want to extend my condolences and my prayers out to each family that has been distraught by this virus. My heart goes out to you. At this present time, the residents in Dougherty County that have died from this virus are 318. Phoebe made the number, I think it was 340 they had. The residents, along with the ones that died in the hospital that come from outside of Dougherty County, may die in Phoebe, so Phoebe give the total number that died in Phoebe. But the number I'm giving you is the residents that died in Dougherty County, whether they was in a nursing home, at home, or in the hospital. I add all those numbers together, that's how we came up with 318 residents of Dougherty County that have passed. There have been 13 more deaths since the last press conference. Last week we had 305, you see it jumped up to 318. So definitely people are definitely down here in the city. There have been 171 females, 147 males. Death by race and ethnicity, white, have been 73 white, 4 Latino, 3 Asian, 238 blacks. Death by race, there have been 107 black men. There have been 131 black females, 35 white males, 38 white females, 2 Latino males, 2 Latino females, 2 Asian females, and 1 Asian male. Again, by the race, we still have 3 over 100. In the age of 90, we have 28. Age of 80, we have 68. Age of 70, we have 73. Age of 60, which is the popular number, is 88. There's 30 in the age of 50, 20 in the age of 40, 5 in the age of 30, and 2 in the age of under 20. We definitely don't want that number to get under 20 to get any higher. Northwest Albany, 2021, 31721, 31707. We have 48 deaths in 31721. We have 64 deaths in 31707. Southwest Albany, we have in 31701, we have 125 deaths. 125. In East Albany, we have a total of 31705, we have 81 deaths. Then if you look at it by the months, the same thing. Those numbers have not changed from last year. Still, March, we have from last year. So instead of going through all the numbers from last year, March, you know, we had 39, 86 in April, 26 in May of last year, 6 in June, July, we had 12, August we had 15, September we had 6. You see the numbers are declining. October we had 6, in November we had 4. December we had 14. January of this year we had 42. That was during the highest so far this year. February we had 17. March we had 5. The numbers are declining again. Different ones must be getting the vaccine. April we had 3. May we had 3. June we had 2. In July we had 2. After the holidays, in July I figured it spiked, so it did go up. We had 29 total in August. And also in September we have just 1. So now I've seen a trend. There usually be more blacks than than whites. It's kind of panning out now. So now we have, just in the past week, we had 7 blacks, 54%, and we had 6 whites, 44%. So you can see it balancing out now steadily. It's not just more blacks now, so it's still balancing out now. I want to say that if one unvaccinated person, a person have not taken a shot in your home, if they're living in the home with you, they can infect the whole household. And that's what we're seeing now when we go to the house. A person may die, E.M.S. go out. One person might have died from the virus or had the virus. Then the rest of the individuals in the house already been exposed, and a lot of them, we find out all of them tested positive too. So like if everyone has said, you're not concerned about yourself, you're concerned about your loved one. This is a holiday coming up. I know we're going to have a good time. We're going to be eating, cooking out, family going to be gathering, but be safe. We don't want this number to spike higher the following next 2 weeks and the next 14 days after this holiday. So mask up and definitely consider getting the vaccination. Again, thank you.
Thank you, Mr. Fowler, for your remarks today. We'll pause now for any questions from the media. Ms. Howell from our social media pages. Okay. Well, as we end today, I do want to mention the efforts of public information officers and the Strive for 75 initiative or campaign. The goal is to increase the percentage of people vaccinated in Dougherty County to 75%. That's a goal that many throughout the community are striving for. We encourage you, as part of the Strive for 75 campaign, it says, do your part, reconsider, get the shot. We will see you again next Friday at 10 a.m. for updates on COVID-19 in Dougherty County and in our community. I bid you a good day, be safe, and be well. Thank you.
The City of Albany, Dougherty County, and several other local organizations have developed the Strive for 75 campaign, the goal of which is to increase Albany and Dougherty's vaccination rate from 35% to 75% in 75 days. Dougherty County Public Health is offering all 3 vaccines on Mondays, Tuesdays, and Thursdays. Appointments are encouraged. However, no one will be turned away who wants the vaccine. For more information, call the Health Department at 639-6424. Do your part, reconsider, get the shot, and strive for 75. The City of Albany, Dougherty County, and several other